So if you're a parent of a kid who plays sports, you've probably been worried about the possibility of concussion.
Oh, it's a very serious issue. And here to talk about some of the sports with the highest risks and what parents need to know is Dr. Mandira Mehra from SSM Health. Good morning. Good morning. To see you.
How's it going?
Great. Thanks for being here so early on a Thursday.
Yep, I love doing it.
So this is sports. I mean, you automatically think concussions in football or hockey, but it's much broader than that now, right?
It is. And, you know, we were just talking during the break that it can happen to anybody, anywhere. You know, I've seen kids from 3-4 years old hanging out at the playground on the jungle gym, all the way up to college athletes and older.
Yeah.
So it's not just restricted to the children, although this is really important, and the more awareness we can raise, the more we can prevent concussions, the more we can treat concussions sooner. So the first thing is, what is a concussion? A concussion is basically a mild traumatic brain injury. Does not necessarily have to show up on imaging. And what that means is you can have a CAT scan, you can have an MRI, changes may not show up on there. You may not have bleeding in the brain. You may not have had a loss of consciousness. All it has to be is usually a blow to the head. Could be violent, could be from football, soccer, hockey, wrestling, things like that. And it can result in basically brain injury. Now, what's happening in that concussion is we think that the nerves in the brain get stretched. They endure some kind of stretch injury. When that happens, that releases chemicals into the brain, which then alters how the brain is processing. So almost think of it as like when your computer is failing, when it has like a virus and you're kind of clicking, and at first it's slowing down, and eventually it just crashes on you. That's kind of what's happening in a concussion, is the circuitry of the brain just isn't firing right, it's not processing right. So the symptoms can be varied. People want to look for things like nausea, vomiting, headache, dizziness, maybe visual changes. Maybe your child reports, well, I'm just not processing right, I'm not able to get through my homework, maybe after reading for an hour or two I'm getting a headache, and then you put 2 and 2 together and you say, oh, well, last week during soccer they did have that head injury. And so we know the contact sports, things like the hockey, football, soccer, wrestling, things like that definitely have twice as many ER visits or emergency room visits for traumatic brain injury. So it's not that we want to tell people to avoid all these sports, because like we were talking about, kids love these things, adults love these things, and of course they're so much fun, but to really be aware that if a traumatic brain injury has happened, if collision has happened, to look out for these signs and symptoms. You definitely want to talk to a healthcare provider. If you see any red flag symptoms, nausea, vomiting, anything like that, definitely going to the ER right away and not delaying.
All right. Dr. Mehra, as always, we love having you here.
Great information.
Yeah.
Great to see you.
Great being here.